Hi, this is Dr. David Scheiderer. I'm the medical director for Health Remedies Incorporated and the director of education for integrative psychiatry, both headquartered here in beautiful Sarasota, Florida. Welcome. I want to just start at the very beginning, okay? And I want you to think about this now. Answer the question, think to yourself, there's only one place on this planet that you are more likely to die of an infection than a chronic degenerative disease. Where is that place? Anybody? Anybody? No, I don't see any hands up. All right, that would be sub-Saharan desert regions. How many of you are tuning in from there? Our marketing research tells us 0% at this point. So we're actually much more likely to die, even though we're all afraid of infections, and we should be to a certain degree. We're all dying from chronic, smoldering, degenerative diseases, and you know what they are. Heart disease, diabetes, obesity, certain types of cancer, almost all of the psychiatric conditions that I treat every day. Neurodegenerative conditions such as Alzheimer's, Parkinson's, Lou Gehrig's disease. Those are all chronic, smoldering, degenerative diseases. So I've pretty much dedicated my life. I'm an MD. I'm highly trained, really experienced. I've been doing this more years than I care to tell you. Look it up if you're that interested. In most of my recent career, I've been spending it trying to treat and perhaps more importantly prevent those diseases of civilization, we call them. So it used to be for millions and millions of years that infections indeed did pose the greatest threat to you as an individual and to the species as a whole. But something is going on in the environment that has, and I'll tone this down, but there are changes in the environment that are conferring disease liability to genetic profiles that were once benign. What in the heck did I just say? Well, basically, our genes have not changed in a million years. So that's not really what's responsible for this flurry of chronic degenerative diseases of civilization. What is causing that? What are some of those environmental changes that are leading to this rapid growth in these really awful diseases that are killing us in all places but where? That's right, sub-Saharan desert regions. Well, one of the biggest changes has to do with loss of old friends. What does that mean? Well, it really means that the bugs that we used to carry around in our gut microbiome, we call that technically, has changed dramatically over the last 150 years. And as such, we all suffer from what's called leaky gut. If you want the technical term, you fellow nerds, that would be increased intestinal permeability, intestinal hyperpermeability. Really what that's saying is decreased gut microbial diversity, i.e., changes in our gut bugs have led to a leaky gut, which leads to systemic inflammation, which leads to all kinds of dissonance among various physiological systems. What does that mean? Well, it changes our neurotransmitters, our hormones, our adrenal output, our immune reactivity to bring about those very diseases of civilization I just mentioned. Now, why is that important? Why do I have to get that out right at the outset? Because everything we're going to talk about going forward, whether that's a disease state, a constellation of symptoms, insomnia, binge eating disorder, Alzheimer's, depression, anxiety, you name it, we have to have some framework to put those concepts on, those entities on. And then moreover, when we start talking about interventions, whether that's a pharmaceutical medication, as an MD, I do that every single day with my patients and clients, or whether that's lifestyle modification, I also do that every day, or whether that has to do with supplements, vitamins, minerals, nutraceuticals. How can I leverage those interventions? How can I utilize those options to lessen the chance that you will get those dreaded diseases, better your treatment if you indeed have them, and most importantly, how do we put them off forever and ever and ever, right? And so that's much of what we're going to be talking about. So whether I'm talking about saffron for ADHD or depression, or whether I'm talking about fish oil or probiotics or vitamin D3, we have to understand, I think, what the heck are we trying to accomplish and how that fits into this framework of basically changes in the environment, decreased gut microbial diversity, i.e. there are changes going on right here. It's all about the gut. Megan Trainor told us it's all about the base, so she's kind of right. It's all about the gut, right? And so that's one of the reasons for so many of my patients, it's seal and heal a leaky gut is one of the first things I do. But moreover, after that, we have to right-size inflammation. We then have to resuscitate tired adrenal glands, meaning you have to support those adrenals. That's your main stress response system, by the way. We then have to replenish your depleted neurotransmitter stores. We then need to balance your hormones, and so on and so forth. Well, how do I do that? Well, stay tuned.